All right. Hello, everybody, and welcome to our next session of today. If you're just joining us, we've got this session and one more to go before we wrap up. My name is Adam Hoffman. I'm the Vice President of Global Branding Community here at Singularity University. Super excited to be able to bring you all this great content. If you've missed any sessions, you can go back and watch the replays. Just click schedule. You can find them all there, and then our team will be sharing lots of links along the way if you want to go back and find even more content. But for this session, we are going to be talking about how AI can be leveraged for the increasing threats of future pandemics. I'm joined by Bradley Twynham, who is a technology strategist with 25 years as an innovator and advisor in the enterprise computing space. He's also on the board of a number of AI medtech startups and one of the largest public health administration organizations in Australia. He's passionate about reshaping the current global health system and utilizing exponential technologies to reimagine a more equitable health system for all. Thanks for joining us.
Thanks, Adam. Hey, Adam, just before you go,
sure.
I noticed that yesterday you introduced everyone to your furry friend. I wanted to introduce everyone to mine.
Yes, please.
The public face of COVID-19 here in Australia. That's Carly Doggerson, in case everyone's interested. So I thought I'd just make that introduction, seeing as though we're on a dog theme. But also, I just want to ask you a question. I mean, I still am struggling to get this whole toilet paper thing. And I've probably asked over 100 people now, like, if there's one item that you want to hoard during this pandemic, what would it be? I mean, for me, it's coffee capsules. I would kill for coffee capsules. But what would it be for you?
Does it have to be practical?
Oh, it could be anything. I don't care if it's practical or not.
I mean, if I had to choose a practical, I love water, so I'd pick water. But if it's an impractical thing, I will want all the tater tots that I could possibly get because I love tater tots.
Nice. And anyone who's listening, if you want to suggest the thing that you'd love to hoard, I'd love to hear it. What I am struggling to see is anyone who I've met so far say I would hoard toilet paper. So maybe this is the conspiracy theory of COVID-19 that we've all been hoodwinked by the toilet paper companies.
Possibly.
All right. Thanks, Adam.
Yeah, you got it.
Yeah. So in preparing for this session, I was thinking about how can I put a human face to this discussion around AI. And I was doing some research, and one of the papers I found was a Global Preparedness Monitoring Board report. And the Global Preparedness Monitoring Board, for those who don't know, is a joint organization between the World Health Organization and the World Bank. And they put an annual report together on how prepared we are for health emergencies. And the opening of that report, when I read it, hit me in the face. And I'll read it to you. It says, there is a very real threat of a rapidly moving, highly lethal pandemic of a respiratory pathogen killing 50 to 80 million people. Now, this report was published in September of 2019. Now, I don't know if this particular group of people had some kind of super intelligence in terms of an AI that they were using. I would suggest probably not. Maybe they used a crystal ball. But I think more than anything else, they were trying to make this point to our world leaders. And that is that we need leaders to care about pandemics. But the flip side of that is that means we need to care too. And I want to take that thought into this entire conversation as we talk about artificial intelligence, because if there is one technology that we should be leveraging in pandemics, it's artificial intelligence. Because if there's one thing we've learned through this COVID-19 crisis is every hour counts. But the amazing thing is we now know, and if you didn't know it through the last day and a half, I'm sure you do now, that pandemics are here to stay. They're not going away. And perhaps, you know, in the future, we'll have pandemics that spread faster and have greater impact than this one. This particular graph shows all of the viruses and bacteria that have a potential to outbreak and cause future pandemics. But these are the known ones that we have today. And there are a number of predictors that make this more likely. The massive urbanization, we have the ability to jump on an aeroplane and be anywhere in the world within 13 hours that can spread disease very quickly. We have advances in microbiology and virology, and pathogens could be released either accidentally or deliberately into the ecosystem as a result of that work. So pandemics are a reality of our future, and we do really need to start caring about this. And I'm hopeful that if COVID-19 teaches us anything, it's that an emphasis needs to be on this, to solving for the future and really creating a paradigm shift, particularly within our health system, as to how we deal with these particular crises. But it's not just the health issues, it's also the increasing cost that is going to increase as well. And there are some analysts who are suggesting that with COVID-19, it could cost the global economy in excess of $3 trillion in both social and economic impact. And if you think about that, what's happened with the market so far is probably the tip of the iceberg as we see the ripple down effect of what this particular crisis could mean, both socially and economically, globally, over the next months, if not years, as it unfolds. But what about AI? How has AI been leveraged through this particular pandemic? And it's important with AI that we separate the hype with the reality. And the reality is that for all of its hype, AI hasn't been leveraged where it counts the most during this pandemic. And that might come as a bit of a surprise for most people. But for me, the evidence of that is probably in the decisions or lack of decisions that have been made by our global leaders. Because the reality is, if they're not using artificial intelligence, or if they are using artificial intelligence, we are looking at a level of incompetence that you could almost say would be deliberate. So I would suggest that artificial intelligence isn't being leveraged very much at all during this pandemic, but it's something we do need to leverage going forward. But it doesn't matter how much artificial intelligence you have, it probably would never have predicted this. Probably would never have predicted that toilet paper would have been the item that everyone reached for during this pandemic. But if we turn our attention now to where AI is most applicable and can be leveraged, it really is the killer app, and excuse my pun, during this pandemic. And there are 4 key areas where it could be being leveraged. The first is in augmenting policy and decision making. The second is in prediction of outbreaks and the spread of the infection. The third is in diagnosis, and the fourth is in treatment. And I just want to take a few minutes to talk about where AI has sort of evolved in each of these areas. The first, in terms of augmenting policy and decision making, when I was starting to do my research for this particular talk, I put a call out to my network in terms of, does anyone know if AI is being leveraged within any health organization and agency around the world? And this is what I got back. I believe that health agencies in particular need to leverage artificial intelligence, and the big lesson for health agencies in terms of scaling health services, making sure necessary services are where they should be as the virus spreads. This can all be leveraged using artificial intelligence moving forward. And so if there's any message here for health agencies around the world, this is an area you need to invest in terms of moving forward, ensuring that test kits are strategically placed and decisions are made as outbreaks occur, and we understand where that spread goes. And turning our attention to prediction. So there's been a number of AI solutions that, I guess in their infancy, have been involved with prediction. The 2 that come to mind are Blue Dot and Metabiota. Now, Blue Dot claims that they predicted the outbreak prior to anyone else. I find that a little contentious. Probably, I would say, if anything, it was around the same time as any experts would have. But these AI solutions use natural language processing. So they look at news outlets, health records, airline schedules, and they were reasonably able to predict certain things. So Blue Dot, for instance, predicted that by March 3, we would have 127,000 cases of COVID-19 around the world. They overshot that by about 30,000. But given the unpredictability and the inconsistencies in the data they were looking at, you could probably say that that's a pretty good result for an AI algorithm in terms of prediction. The biggest problem we have today in terms of being able to leverage AI in future pandemics is data. The data we have available today in this pandemic is tremendously unreliable and inconsistent. And if we are to leverage AI in future pandemics, this is a problem we need to solve. And I'll talk about that a little bit later in the presentation, because I don't think most of us really like what that means, but we'll get to that shortly. If we move to diagnosis, where AI has been used in diagnosis, there's a group of scientists in Wuhan who were using CT scans and training a deep learning algorithm to look at those CT scans to predict COVID-19 cases and provide diagnosis around that. So they took 49,000 anonymous images from 106 admitted patients, and they tested this on 27 patients. And what they found was that the algorithm was able to predict COVID-19 to the same degree as an expert radiologist. Now, that's really interesting. It's a great result if it's believable. However, the more interesting thing about this, and the big learning from this, is that what they found was due to that ability, the workload reduction on radiologists on the front line reduced by 65%. And this speaks to the point of where AI is really useful in terms of serving those people on the front line. It's reducing their workload. And in times like this, we need to reduce their workloads as much as possible. So this is a really good case study for how AI can be used in terms of reducing that workload. If we move now to treatment, for me, the standout here is benevolent AI. And benevolent AI uses scientific literature at scale, and it looks at contextual relationships between genes, diseases, drugs, and biological pathways. And benevolent AI was able to find very quickly potential cures or potential treatments for COVID-19. And they came across a group of anti-inflammatories that are now going into testing that could be used for the treatment of COVID-19. The issue being that the process of now taking that discovery and being able to roll that through in terms of production and then out to the public is quite a lengthy process. So these are just some of the use cases for where AI has been leveraged or started to be leveraged within this particular pandemic. But I need to emphasize, once again, going back to my original point, we need to start caring about pandemics. And we need to start looking at not only where AI can be leveraged at the front lines, i.e. around those 4 categories I just mentioned, but at every level of society. Private industry needs to look at how AI can be leveraged to look at the economic impact it has on their organizations when pandemics break out, to be able to get in front of that. Right down to the individual level, where AI use cases can be developed to help people make vital decisions. Just a little personal story. One of the big challenges I've had over the last couple of days is I chair a school board. And we had to make decisions in isolation in terms of social distancing measures because the government was not willing to close schools. And we actually got out in front of that and made those decisions around social distancing about 5 days before the Australian government did. And we're grateful for that because it protected the most vulnerable members of our community as a result. So we do need to be looking at how AI can be leveraged at all levels of society. So what are the 3 big lessons here? So the 3 big takeaways here is our leaders need to care about pandemics, but we need to care too. We need to be investing in the systems, the processes, and the technologies that can really ensure that when we have our next pandemic, we can get in front of it. Because if there's one thing we've learned here, is hours count. The second takeaway is that AI is not being leveraged in this pandemic, but needs to be in future pandemics. But the challenge moving forward is access to reliable data. I think the issue here, though, is that people are not going to like what that means. Perhaps one solution is providing emergency powers for sovereign data to be made available to a central authority during this time. Because even if world governments opened up that data within their own borders, it's not enough for the AI algorithms to be able to work effectively and be leveraged effectively in the case of a pandemic. And in the case of a pandemic, we're all united globally against a common enemy. So this is really important. And I think it is achievable because we can anonymize that data and we can make that data available. But what it requires is a paradigm shift at all levels of society around how data can now be utilized. The third takeaway here is the health administration in particular needs to invest in AI to assist with policy and decision making for future pandemics. And there's a real opportunity here for the health administration sector, if they do invest in AI, to leapfrog many other sectors within its use. So just a closing thought for you. Let's assume that in your isolation at home with Carly Doggerson on your lap, you started thinking, and maybe you thought, if the economic impact of this pandemic was $3 trillion, maybe it's time to reimagine our healthcare system. Maybe it's time to reimagine a healthcare system that was equitable for all stakeholders globally. Maybe it's time to reimagine a healthcare system that has a paradigm shift as to who pays and how. Maybe it's time to reimagine our healthcare system where data shifts from being a commodity to being a value creator. Or maybe it's time to reimagine a healthcare system that's intrinsically scalable in times of crisis for those who need it most. I believe that we have the exponential technologies available today that can reimagine that health system. And I'm very passionate about solving this problem. And I'd be very interested to connect with other people who are as well. And so my details are there. If you are passionate about this, if you would like to reconnect, I'd love to hear from you. Thanks for your time, and handing it back to you, Adam, for any questions.
Fantastic. Thanks, Brad. I will leave this up. Oh, I was going to leave that up.
I'll put it back up.
That way people can grab your contact information real quick while we start to pivot into Q&A. So you definitely had some good chat commenting going on over in the right-hand panel. Go back and look through that when you get a chance, Brad, and I will pull up some questions for us. So let's do that. So I'll share some questions. If you're not the best suited person to answer them, totally fine. Just let me know. The most popular question, though, I think goes back to one of your first slides. What are some of the reasons why pandemics are becoming more and more common?
Yeah, look, I mean, I think there's a number of reasons, and I did touch on some of those. I think other speakers have touched on those. But look, I mean, I think we have a global population now that's fast approaching 8 billion people. There's questions about whether the Earth can sustain that population. The jury is out on that. But if we look at urbanization and the density of people living in very confined spaces within cities, if we look at the advances in microbiology and virology, there are potential accidents that could occur, or worst case, pathogens being released deliberately into the ecosystem. And I certainly wouldn't say, and there's no evidence for, that COVID-19 falls into that category. Global warming could be a contributing factor, although in the case of COVID-19, it's more attuned to cold environments and warm environments in terms of its effectiveness. So there's some of the big reasons, and I think also the fact that you can jump on an aeroplane and be anywhere in the world within 13 hours. And that just increases the spread of this globally, as we saw, from Wuhan to Italy and then through the rest of Europe. I mean, with the mobility we have today, it allows these pathogens just to spread at an exponential speed.
Yeah, it's a good take on it. And as Brad said, I think there have been at least a couple of these. I think Divya, Daniel, and maybe even Raymond touched on it as well. So go back and check out those recordings in addition to Brad's answer. Another good question that popped up to the top was around cognitive bias. I'm going to take this in a slightly different way. Can you talk a little bit about bias in AI, and then how can we help our leaders leverage data to make better decisions?
So there's sort of two questions I think I hear there. The first one I don't really get, which is bias in AI. I mean, there is a reality around that. I think there needs to be a huge study in terms of ethics. I believe one of the big potential new job positions in the future is that of an AI ethicist, particularly in terms of its interaction in the boardroom. It's something I didn't touch on in this presentation, but in other presentations, I touch on the importance of, boards having to rethink their structures and who they have on boards, and this being a very important issue. In terms of AI informing leaders, I mean, as I said in my presentation, the one thing we've learned with COVID-19 is that hours count. Every hour that you're not taking action, every hour that you don't have the available information you need in order to make decisions around social distancing, around what you close, around whether you close schools, around whether you limit people going to bars, or just even the seriousness and speed that this virus is spreading is critical. And I think AI can help us get out in front of this, providing we have reliable data to do so. So to give you an example, if, for instance, we had a central authority that had emergency powers during times like this, and every sovereign state around the world was required to give their immigration data with a tag of cases that were emerging, then we could assemble very quickly using AI algorithms how this thing is spreading and how quickly it's spreading, rather than through numbers that are probably inaccurate, being underreported, and inconsistent. And so that consistency of data is important. But the big thing here is just one country accessing its data to do this, when we are facing something that is a global crisis, is not enough. It needs to be data that's assembled to be able to make decisions at a global level. And I think that's the big takeaway.
Yeah, it's been interesting how many of these presentations, no matter what angle people are coming from, it comes back either to, we need the government to do X, or we need some type of global coordination effort across these governments, and ideally both, which has left many people, I think, asking like, okay, well, I'm just one person. What do I do about this thing right now?
Absolutely. And I think one of the recommendations that was made by the Global Preparedness Monitoring Board is that the UN needs to step up and become that coordinating body in situations like this. And unfortunately, I think, there's been an absence of the UN at all in this particular pandemic.
Okay, let's try this one. So there's been a lot of talk about how algorithms are increasingly used in ways that reinforce pre-existing inequalities and harmful biases. I think this is maybe where the first question was trying to go. How can we be careful about that in the context of pandemics?
Yeah, look, I mean, I think once again, it comes back to ensuring that we have the infrastructure to support this technology set moving forward. And a big part of that is thinking about how we establish the ethics infrastructure globally. There's been many countries who have developed an AI roadmap, and every recommendation in every one of those countries' AI roadmaps is the establishment of an ethics framework. So I do think that's critical, and I do think that's important, but I also believe that's a huge piece of work that is lagging well behind the technology. And it could be a potential issue as the speed of artificial intelligence outstrips our ability to keep up with that pace of change. So yeah, it's an absolute risk. It's not an easy solution, but it all comes down to how we roll out an infrastructure that ensures that we are looking at this technology set in an ethical way.
Right on. Do you know of any websites that have data that people can access if they want to tinker around with it to build their own models?
I don't know.
No? Okay.
Yeah.
All right. Well, then let's end on this. I liked where you were going at the end with kind of the healthcare system of the future. And you mentioned a couple things, but at the end of the day, what does an equitable healthcare system look like?
Yeah, right. That's a really good question. My definition of that is a healthcare system that everyone is invested into, and every user within that system derives value from, and it contributes to in an equal way. And so one of the things that I've been toying with for a while is how can we use exponential technology where people can monetize their healthcare data in order to scale and procure critical healthcare services. And if you look at that, based on our current taxpayer-based system, that's impossible to do, because the people that require healthcare the most are the ones who are not contributing to the healthcare system in terms of financing it. And I believe there's a real opportunity using cryptocurrencies, blockchain, artificial intelligence to be able to create the infrastructure using exponential tech where we can shift that paradigm of who pays for the healthcare system, but that everyone in that system is creating an equal amount of value within that reimagined healthcare system. So I'd love to share that at some point in the future, either at a summit or an executive program or whatever else we have.
Awesome. Well, I will look forward to that. Thank you for the time today. Like I said, recommend cruising through the chat. If there's people that you want to respond to later on, feel free, and we'll follow up with some more questions that we can probably get answered and share with the community. But thanks for being here today. Anything you want to add on?
No, that's it. Thank you very much.
Awesome. Thanks, Brad. Okay, everybody. That means we've got one session left, and then I'll wrap us up. So we've got Lisa Andrews, another fellow Aussie, coming up. I believe that she's planning on still hosting a workshop. So it's going to be more action-oriented, talking about how we can put some of these learnings into action. So we'll be coming back with her next. I believe our SU team will shortly be posting the links for anyone who is looking to find the replays from yesterday, the Facebook community, contribute to ideas on the Be Innovative platform about solutions to this. And of course, I've got a running list of the resources that everybody's sharing, and we are still working on getting all those slides, but those should be there in the next couple hours, days. We will keep working on that. So thanks for being here. We will see you in the next session here in about 10 to 15 minutes. Thanks.